everybody, I'm here today with Stephanie, and Stephanie is a triathlete and has some iliotibial band problems that we're going to address for her today using some products and kind of just this is the way that I would approach it. And everybody is free to approach this kind of concept on their own. I'm just going to give you an example of a way that I've found to be effective for treating it with Stephanie. So for her IT band symptoms that she has are here on her right side. She mostly has pain over here, irritated with running, cycling, more so than swimming, but kind of lateral thigh pain comes down into the side of her knee a little bit. So, one of the things that clinicians tend to really struggle with is what exactly am I treating with the IT band? The research shows that the iliotibial band, you're really not doing a whole lot to it. There's been studies where they've tied it to vehicles and pulled on it and it doesn't break. So you as a clinician, I promise you, are not going to break anything on your patient. The problem is that treating this area can be highly sensitive for patients, and when the tissue has become irritated and angry, you struggle as a clinician to find a treatment plan for them that is effective but also is within their pain tolerances. So what you need to do is you need to make sure that you've addressed that. And you can do that numerous ways before we get into this, and whether you're using some sort of modality, whatever your modality of choice is an excellent way to kind of help with that. But the meat of the problem of really getting in here is to treat the soft tissue kind of in there. And with her, and it's going to be mostly the vastus lateralis of the quadriceps. So what we're going to do is we're going to focus on mobilizing the soft tissue in that area, getting the muscle unstuck, getting it to kind of move and address it that way. So to do that, the first thing we're going to do is we're going to talk about stretching out that muscle over some different products. There's lots of ways you can do this. People will use foam rollers. People can use smaller rollers because sometimes this is just too much. You can use a ball. We're going to show you a couple of different ways to try that, and then we'll go into how to actually treat the tissue after that. So the first thing we're going to do is I'm going to have you lay on your side this way. Actually, let's start with this. So if you have a patient where the tissue is really irritated, you may not want to go to something as aggressive as a big foam roller right away. You may need to start with something smaller. Flex bar is great for that. Let me have you straighten your legs out. What we want to do is we want to get that bar, let's say her pain's right in here. You want to get it to a place where she can put a little bit of pressure on that thing. She rolls on it, maybe find that spot that's irritated, and you want to get the patient to just kind of rest right there for a few seconds. And then we want to get you to go ahead and contract your muscle and squeeze it right into that bar, push into it, push into it, push into it, and then just relax again. So what you're really trying to do is reset that system, get the tissue to open and close, get everything to start opening up. Again, kind of depending on the patient, maybe you need something a little more. You could use something, any sort of ball, something like this, where you get a little more of a curvature to get a deeper compression into that tissue. So we come up on there, kind of roll down, roll up, again, find that spot, right? We're going to hold it for 4 seconds. Then we're going to contract down into that ball, push down into it, push, 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 and then we're just going to relax. Good. So again, depending on your patient, depending on the response, depends on what type of tool and equipment you use. This time we're going to use this really big one. Come on up onto that green side, right? And what I want you to do is you're going to push yourself up on the side bridge up and just kind of roll down towards the bottom, get in that spot. Same thing, we're going to hold right there. And then I want you to push down into it, push, 2, 3, 4, and then just relax. Good. Go ahead and relax. Good job. So when treating patients, it's always important to make sure that your treatment plan is appropriate for what they can tolerate. Some of your high-level performers like her, have exceptional systems where they can deal with uncomfortable and pain. That's why they do triathlons, because they're a little crazy. But it just kind of lets you know, your programming needs to be appropriate for your patient. Now, let me have you roll onto your other side. So now as we get in here to treat her, right, people can only kind of get into some tissues with different angles, and they could put as much pressure on there as they'll tolerate. Sometimes as the clinician, you want to provide a little more force into that tissue. This is a great way to do it. Kind of coming proximal to distal, kind of through that whole, same thing, vastus lateralis tissue. As you see, I'm just kind of rolling, stretching it out. I find that spot that's really angry, give a little bit of pressure and come off of it. Same thing. Little pressure and then come off of it. How you doing?
Okay.
Right, this isn't something you need to do for 10 minutes, right? This is just part of your process, right? Again, the tools are just an extension of treating the injury with any way that you would do it, right? There's nothing to say that you couldn't do that manually, right? That we couldn't just get a little bit of just something so that the skin's not sticking to your hands. And same thing, you just kind of palpate, get in there, find where that tissue's really angry. For her, it's right here, right? So you can just kind of slide down that with the heel of your hand, right? You come across, and again, it's all dependent on what your patient will tolerate. You can use bigger strokes, kind of with your hands, you get a little more feedback from the tissue. You can use your elbow points, get in there and really kind of provide that for them. Good, how's that? Yeah. And then, if you really want to kind of get in there, instrument-assisted tools are great, especially as a clinician. If you're treating patients all day long, it can be exhausting using your hands. So different techniques for different ways to kind of get in there. Same thing, right? If you kind of look at the overall concept, all we've been doing is just kind of moving that tissue. Just kind of coming through there. Working on it, checking your patient's feedback, make sure that your patient's doing okay with it. All attempt to do that. As you do treatments like this, right, it's important that you find some sort of objective measure to do before and after so you see the impact of it, whether that's testing her glutes in side lying before, whether that's an objective measure, a written measure, or whether that's just a pain scale, right? Just so you know how your patient's doing with that. Just like that, right? And the other thing to understand is that this didn't get here overnight, right? We didn't get here after just one bike ride or one run. It's a process. So treating it is a process, right? You need to make sure your expectations are good with your patients, that they understand this is going to take some time, it's going to take some manual labor, and we're going to have to put some effort into it to resolve it. But I think if you do that, I think you'll be successful treating this.